And you can just hit the arrows.
Okay, great. Okay, so good morning and happy spring. I only realized yesterday that spring had already started. I was like, wow, I've been busy. I didn't even, wasn't even aware of that. So some spring flowers here to sort of brighten our day. Okay, so today I'm going to be talking about bladder health for senior women. We'll be learning about the anatomy and function of the urinary tract. We'll look at health conditions and drugs that can affect the bladder, learn about urinary incontinence, and what we can do to help maintain a healthy bladder. Excuse me 1 second. That's all right. Angela's needing to do something. Okay. Okay, now it's not.
Oh.
Okay, there we go. All right, the bladder plays an important role in our everyday life, so it's helpful to understand a bit about how the bladder functions. The bladder is part of the urinary tract, and the upper tract consists of 2 kidneys located in the lower back, and they're attached to the bladder by 2 narrow tubes called ureters. Urine is produced in the kidneys and flows from the kidneys into the bladder via the ureters. The bladder is placed in the lower urinary tract along with the internal and external urethral sphincters. These sphincters keep us continent and control passage of urine from the bladder through the urethra to outside our body. Okay, here's a picture of the bladder. It is a sac-like muscle that can stretch and expand as it fills with urine. This detrusor muscle, as it's called, is made up of smooth muscle, which is connected to our nervous system, but not under our voluntary control. It's controlled by the autonomic nervous system. So these smooth muscle fibers of the bladder have stretch receptors in the wall of the bladder, which respond to the stretch of the bladder as it fills with urine. The stretch receptors, when activated, send signals via nerves to the spinal cord and brain and tell those structures that the bladder is filling. And we would then experience the sensation of the bladder getting full, and often we'll experience an urge to urinate. Okay, here is a picture of those sphincters. So up in this area, this is the bladder, and we can see the muscle. Oh, excuse me, that's the urine there, actually, excuse me. Here's the bladder. Okay, here's the wall of the bladder. Okay, and as part of this bladder wall is the internal urethral sphincter. So once the bladder empties, this sphincter closes and the bladder starts collecting urine again. Here is the urethra. And then here is that external urethral sphincter, okay? So this is muscle that we can control. This we cannot control, that internal one, but the external one we can, and is made up of muscle, which contracts, that we can contract, but also along here are our pelvic floor muscles. When they contract, they help squeeze this urethra closed. Okay, so those are some of the structures that we're working with. Okay, one more thing to learn about is what's called the guarding reflex. So as the bladder fills, the urethral outlet remains closed, as I said. But as it fills up, these signals are sent to the spinal cord, sort of warning that the bladder is filling. And so signals are sent from the bladder to the spinal cord that then go to the external urethral sphincter. And it causes that sphincter to contract, and that helps keep the urine in the bladder. But the sphincter also then sends a message to the bladder that tells it to calm down. And it needs that, because oftentimes when we get an urge to urinate, we can't just run off to the bathroom. Sometimes we can, but sometimes we can't, and sometimes we have to delay. So this guarding reflex sort of helps us. It helps us to be able to delay urination. Now, in addition to that reflex helping us, we can also contract our pelvic floor muscles, which can also help delay urination. The pelvic floor muscles and that external sphincter work together. Okay, so if we look at the graphic on the right, we'll see a number of things, some of which I really can't explain because, to be honest, this is a very complex system that has, there's input going from different structures up to the brain, to the spinal cord, to the bladder, to the sphincter, and 2 different nervous systems are involved. It's very, very complex. Lots of things are happening, but the guarding reflex that we just spoke about, here we go, is we can see here is those, in the bladder wall, we have those stretch receptors. So it sends a signal to the spinal cord, goes up to the brain, but to the spinal cord. And then here we get the response, that reflex, to the external urethral sphincter, telling it to stay closed, okay? The other portion I'm not even gonna begin to explain because, to be honest with you, I don't understand it perfectly, other than to tell you it's complex. All right, so if we wanna say, well, how does it work that we can begin the process of urination, is that what we do, we sit down on the toilet, we relax our pelvic floor muscles, which also relaxes that external sphincter, which sends a signal to the internal sphincter to relax and open the bladder neck. And also then that results in the bladder actually contracting and emptying, okay? So we start the process by relaxing our pelvic floor. Excuse me. Okay, so the convex is true if we're trying to delay urination, okay? We know that we have that guarding reflex, that's part of it, but then we can add to that contraction of the external sphincter, which happens in a reflexive manner by contracting the pelvic floor muscles ourselves, and we can sustain that contraction, sending a message then to the bladder that we're not ready to go and urinate, or we can't do it right that moment. So that contraction of the pelvic floor and the external sphincter does help calm the bladder and allow us to delay. Okay, normally we void about 6 to 8 times a day. Obviously, that's very dependent on how much you drink. Voiding 0 to 1 time at night is in the normal range. And one other thing that's important to realize is that when we urinate, we never fully empty our bladder. What remains in our bladder is called the post-void residual, and it's about 1.5 ounces of urine. The bladder does change some as we age. That bladder muscle has a tendency to toughen and become less elastic. And you can imagine if it's not as elastic, it's not going to be able to stretch as much. And so we may not be able to hold as much in our bladder as maybe we were able to as when we were 20. The bladder wall also weakens and somewhat, and because of that weakness, maybe we're not going to be able to empty the bladder as well. So it's that strong contraction of the bladder that causes it to empty. If we don't empty our bladders as well as we should, remember we never totally empty it, then sometimes that post-void residual increases, and that can be make us a little bit more susceptible to having a urinary tract infection. Our ability to delay urination can decrease a bit as we age. Also, the urethra shortens and its lining becomes thinner. And that can result in the external sphincter not closing as tightly as it once may have. Okay, I'd like to talk a little bit about urinary incontinence. We have stress incontinence, urge incontinence, mixed incontinence, which is really a combination of the first two, overflow incontinence, and then I'd also like to talk just a bit about neurogenic bladders. Stress urinary incontinence is leakage from the bladder that can occur when the intra-abdominal pressure increases to a point that it overcomes the external urethral sphincter's ability to keep the urine in. So here's a picture of intra-abdominal pressure. We can increase this intra-abdominal pressure by holding our breath and bearing down. This is called the Valsalva Maneuver. People often can do this when trying to have a bowel movement, getting out of a chair, sometimes turning over or getting out of bed, or even sometimes with exercise. The Valsalva technique, or this bearing down, is not a good thing for many reasons, but it can actually force urine out of the bladder. So as I mentioned a few things where it can happen. So it can happen with exercise, also with coughing, sneezing, laughing, lifting a heavy object, or getting out of a low car. Stress incontinence can happen at any age. You will find it in young women, but it's more likely to happen or to occur after menopause. And any leakage that does occur with stress incontinence typically are small amounts of urine. Some of the things that contribute to stress incontinence can be a loss of pelvic floor muscle tone and strength. This can happen just over the years as we age, or can happen more abruptly as a result of childbirth, where there might be some nerve or muscle damage. Women who've had a hysterectomy can have a little bit more tendency towards stress incontinence. They've lost some of the ligamentous strength. Oh, that's not the right word. Ligamentous, I can't come up with the right word, sorry. Support, there we go. The ligamentous support that is normally there. So the bladder can become a bit more mobile. So that can become an issue. It's not necessarily going to happen, but it could. Obesity can is going to put more pressure on the pelvic floor muscles, which can weaken them. There's going to be more pressure on the bladder itself. So obesity can be a problem. I mentioned a little bit before about menopause. The loss of estrogen can have that effect on the external sphincter and the urethra, and can result in some stress incontinence. Anyone who has a chronic cough from smoking or lung disease can have problems with stress incontinence. There's a lot of pressure on the pelvic floor with that coughing, particularly if you get strangled, and that can lead to incontinence. And finally, constipation can be a problem. Sometimes because people are bearing down, which is a bad idea, but they're trying to have a bowel movement. So sometimes we'll be holding their breath and bearing down. Again, if you're doing this a lot, you're going to be putting a lot of stress on the pelvic floor. So what are some of the things that we can do to help stress incontinence? If you really have a significant weight problem, losing weight can be a help. If you're a smoker, to stop smoking. Probably one of the most important things is to strengthen the pelvic floor. And we'll talk about this more a little bit later. It can be done without biofeedback, but biofeedback is a way that we can use a device that helps us know how well we're strengthening the pelvic floor. It doesn't really do anything for us other than let us know what we're doing. But there are other ways. If we can feel what the pelvic floor muscles are doing, then a lot of times we're not going to need biofeedback. We can also use our own finger. If we insert the finger into the vaginal opening, into the vagina, we're able to get a sense of what those pelvic floor muscles are doing. So that's one way we can use our own biofeedback to help. There are medical interventions that would be proposed possibly by an OBGYN or your gynecological urologist, urogynecologist, that's what they call them. So those are possibilities as well. Okay, we're going to talk. Oh, let me just go back for a second. The biggest thing, or not the biggest thing, but one of the bigger things is it's really important, and I didn't add it to the list, not to hold your breath and bear down and you think, well, I probably don't do that. Or I don't do that to have a bowel movement. Great, breathe when you're having a bowel movement. You can push, but you got to keep breathing. But we do, individuals that are obese or just have difficulty moving have a tendency to hold their breath when they're getting up from lying down, when they're getting out of the car, all kinds of things. So the more that we can keep breathing when we're moving, if it's a difficult movement, I think the less likely that we're going to have leakage with that movement. Okay? Okay, urge incontinence. It occurs when there's a sudden and strong urge to urinate that is hard for us to control long enough to get to the toilet. It usually results in a larger loss of urine, usually sometimes enough to wet your clothing where you need to change your clothing. There's obviously urgency that's related to this, and people with urge incontinence often have a urinary frequency, so they're going to the bathroom quite frequently. I had one young woman years ago who went to the bathroom about every 20 minutes, and talk about something that really can interfere with your life. And also, people with urge incontinence can experience nocturia, which is waking frequently at night to urinate. Okay, these are some of the things that can contribute to urge incontinence. So the first is that there are things that we can drink that can irritate the bladder. We'll look at a list of those in a minute. There are some foods as well. I've never focused as much on the foods as the beverages, but we'll look at that more in detail in a minute. Some people develop just bad bladder habits, and we'll talk about what those could be. Not getting enough fluids can be a problem. This concentrates the urine, and that can be irritating to the bladder. Urge incontinence is a lot about the bladder being irritable. So it needs enough fluid, and particularly needs water. They say that half of what you drink should be water. And then some people just get in the habit, for reasons I'll talk about later, of just going to the bathroom too frequently. And that's not a good habit. It's one of those bad habits. Okay, let's talk about some of those bladder irritants. Caffeine is a major one. Caffeine, as you know, is a diuretic, so it's going to affect how the bladder functions. You're going to urinate more if you have caffeine, but it also irritates the bladder. So it's something that if you're having problems with urgent incontinence, that you need to at least look at. Also, citrus juices, orange juice being among them, can be problematic. Drinking alcohol, again, this is a diuretic. Carbonated drinks don't bother everybody but some people. I had a lady who drank a lot of ginger ale, and once she stopped, her problem cleared up. So that can be a problem. Other things that can be problematic are spicy foods, chocolate, artificial sweeteners, and honey. And there may be other things that are not on this list, but okay. Now, sometimes when people have problems with stress incontinence, they think they'll go to the bathroom, start going to the bathroom a little bit more frequently. And I think often they're doing this because they think that if I keep my bladder empty, I'll have less of a chance of leaking urine. Now, that seems like a good idea, but it's not really. Because then the bladder gets used to not having much urine in it, and then it starts thinking that it's getting full when it's not full at all. And so that's when sometimes stress incontinence can sort of morph into a combination of stress incontinence and urge incontinence. So we should try only to go to the bathroom to urinate when we need to. Another thing too would be that I'm going to go just in case, or I want to start on empty because I don't know where the next bathroom is going to be. Again, there are instances where this is a smart thing to do, but when we're doing it all the time, that is not good. And I've had some patients that I might be seeing for a back problem or a hip problem or shoulder problem. And what I've noticed is with some of them is that they're going to the bathroom before therapy and they're going to the bathroom after therapy. And I'm thinking, that's not normal. So sometimes I'll bring that up to them. But even though there can be a reason to start, go to the bathroom before you leave to go out, but just make sure you're not doing it too frequently. Okay, so not getting enough fluid, as I spoke about before. Sometimes people will be thinking, well, if I don't drink, then I won't have leakage. Okay, again, it seems like a good idea, but it's not. The bladder really needs fluids and really needs water. You don't want to go to excess, but you want to make sure that you're getting enough fluid. And one easy way, it might be a little bit later in the slide, but that may say we should have 6 to 8 glasses of fluids in a day. That depends on how big a person you are and so on and so forth. But one way to look at it is to actually look at our urine. When we're getting enough and we're hydrated enough, our urine is going to be quite light in color, almost even clear, but light yellow. If it's starting to have darker color, that means you're really not getting enough fluids and probably not enough water. Now, there can be medications and such that might change the color of the urine a little bit, so need to keep that in mind. But generally speaking, we can get a pretty good sense if we're getting enough fluids by how our urine looks. Okay, so how can we help urge incontinence? We can try to eliminate those bladder irritants. Sometimes if you want to feel like you need to try this, I would start with caffeine, do one at a time and sort of give yourself a test of a number of days and see if it makes a difference. But probably even before eliminating any possible bladder irritant, I would make sure you're getting enough fluid. I would put that probably as number one, and then look at the bladder irritants if you're not getting the results you want. I had a woman who had, she couldn't get through the church service on Sunday because she had to go to the bathroom more frequently, then she couldn't make it that hour of the service. And truly, and I think she was getting up at night uh, uh, numerous times, 3, 4, or 5 times at night to go to the bathroom. And the first thing I started on was just drinking more water, making sure she was getting fluids. And she came back and thought it was a miracle. I mean, it was awesome. It makes me look really smart, but it can be a very simple thing. It's not always the solution, but it can be a wonderful thing to try first. Okay, the next one, time voiding plan. That is really more what you would do as part of physical therapy, most likely, because you need someone to sort of give you a little bit of guidance. But what it essentially is about is that if you're a person that has to go to the bathroom every half hour or 45 minutes, hour, and what we want to try to do is stretch out that time. So we would give you a time that you must go to the bathroom, every hour, and then, but that's sort of what a time voiding plan is. But typically, that's a plan that's given to you. There's also behavioral training that the therapist can do with you to help you know what to do when you have a strong urge. Our natural tendency when we have, let's say we've been out in the community, we've come home, everything's fine, we don't have to go to the bathroom, we get out of the car, we get to the door, we put the key in the door, and we're like, eek, I gotta get to the bathroom. And we're running, we're trying to do everything as quickly as we can and trying to get to the bathroom, sometimes successfully, sometimes not. But really, it's much better to just stand in place, tighten your pelvic floor muscles as much as you can, even if it means you lose a little bit of urine, and then try to walk in a dignified manner to the bathroom. So sometimes you have to stop another time along the way, but that's sort of what behavioral training, among other things, would cover. And then most importantly, trying to strengthen the pelvic floor. Now, we know that this plays a greater part in stress incontinence, but in my mind, it plays a part in urge incontinence because we need to handle that urge. We do have that guarding reflex that helps us. It may not be working that well, but what we can do on top of that is to contract our pelvic floor muscles to help keep that external sphincter closed. The stronger our muscles are, the better we can send that signal to calm the bladder. Okay, as I mentioned before, mixed incontinence is a combination of stress and urge incontinence. Overflow incontinence can happen when people have had a spinal cord injury, or in some cases with a poorly managed diabetes. And what happens with overflow incontinence is the bladder stays full all the time, and then just there's small amounts that are leaking out almost constantly. A neurogenic bladder is something that is not common. I wanted to bring it up only because as we age, we have other comorbidities. We may have Parkinson's disease, or a spouse may have Alzheimer's or a stroke, and it helps us to understand maybe what's going on and why they may be experiencing incontinence. But with a neurogenic bladder, there's a loss of control of the bladder as a result of brain, spinal cord, or central nervous system dysfunction. So it can result in individuals either urinating too little or too much. And like I said, it can happen with diabetes, MS, Parkinson's, Alzheimer's, stroke, or a spinal cord injury. Okay, medications can also affect the bladder. And some blood pressure medications are alpha blockers, which work by dilating blood vessels, which decrease our blood pressure. But they can also relax the muscles at the bladder neck. Okay, that's where that internal urethral sphincter is. And that then makes it easier for urine to flow more easily from the bladder. With certain medical conditions, that could be a positive thing, like men with prostate problems, but for most of us, that would be not such a good thing. But if you're taking a blood pressure medicine, please don't stop it. And I bring this up only that sometimes if you take a new medication and you start to experience incontinence, then you might just bring this to the attention of your doctor, okay? I don't know enough about all blood pressure medications to think that it affects, some may cause this problem, others may not. And I presume that it does not cause this in every person. So please don't stop taking your blood pressure medication. Antidepressants are varied in their effect on the bladder. Some can actually help urinary incontinence, and others can impair the ability of the bladder to contract or decrease our awareness of the need to urinate. So it's just good to be aware of this. Diuretics have an obvious effect on the bladder. They're going to make us require us to urinate more frequently. And if you're having urge symptoms or such, or even stress incontinence, this may make things a little bit worse for you. Sleeping pills, they're a sedative. And so when they're sedating you in one way, they're also sedating your bladder. So that can cause problems with incontinence. So again, just be aware if you are started on a new medication and you're noticing a problem, just bring that to the attention of your doctor. Okay, so let's shift now from looking at the types of incontinence to looking at the pelvic floor. I'll point out some structures in a minute, but when we talk about the pelvic floor, we're going to include the external urethral sphincter. They are two different muscular units innervated by different nerves and with slightly different functions, but generally it's good to talk about them together because as far as I'm aware, even as a physical therapist, I don't know how to control my external sphincter and not contract my pelvic floor. There might be a way, but I just may not be aware of that. Okay, so let's look at some of the structures here. First, we're going to be looking at the perineum from looking up into it from the bottom, okay? So just to orient ourselves slightly, here is our tailbone, and our sit bones are sort of in this area. And we can see these muscles here, this is all the pelvic floor, okay? Buttock muscles here, buttock muscles there. We can see the opening of the anus here, and the vagina, and the urethra, okay? But you can see how these pelvic floor muscles really create a sling for the pelvis, okay? Now, if we look at the pelvic floor muscles from above, it's just nice to get a little different view. So we're taking out all our abdominal organs, and we're looking down into the pelvis. And again, here are our pelvic floor muscles. Okay. Here's our tailbone. Here's the anus, the anal opening, the vaginal opening, and the urethra. Okay. All right, now we're looking at the pelvic floor muscles, which are down here, and continue up that way. We're looking at them from a sort of a side view. And here we see the bladder and the uterus. Here's the vaginal vault and the anus going up into the rectum, okay? So it's nice to see, so if we're thinking of those sphincters, again, we've got that internal urethral sphincter here and the external sphincter here, okay? So let's talk about why these pelvic floor muscles are so important. They provide support for our pelvic organs. They support the bladder and stabilize the bladder neck. And they're that additional reinforcement of the external sphincter enclosure of the urethra. Okay, at any time really, but especially when we're experiencing a strong urge to urinate, or we sneeze, or we cough. Okay, so now we're going to talk about Kegel exercises. It's a little bit of a dangerous thing to do, only because usually this is not the best way to learn how to do Kegel exercises, but we're going to talk about it a little bit. It'll give you an idea. There was a study that looked at people were just given verbal instructions about how to do Kegels, and it turns out 50% of them did them incorrectly. So it may be that you already have a sense of how to do a Kegel exercise or contraction of your pelvic floor muscles, and it might be something that's more difficult for you. And again, this is where physical therapy can help you if you struggle with that. But we're going to actually try to do a Kegel exercise together. So what I'd ask you to do is just to sit upright in your chair and actually close your eyes. Okay, I think it's better to try to feel it more than anything else. Okay, you may have read the graphic, or not the graphic, but the words there. But so this is a little bit graphic what I'm going to ask you to do, or the visualization. I'm going to ask you to close your eyes and imagine that you're going to pick up a marble with your vagina. I know that sounds weird, but it actually works pretty well. A patient told me this one, and I really like it. So you're going to, you're just going to imagine that you're going to pick up the marble, grasp it, and pull it up into your pelvis. Okay? And I'm going to have you do that a couple times. So now relax your pelvic floor muscles. You're going to think about picking it up again, grab a hold, pull it up into your pelvis. Okay, those are your pelvic floor muscles if you're having success. Try one more time. You're going to grab that marble and pull it up into your pelvis. Okay. Now, two things that people often do, and you can check to see if you did this yourself. One is to hold your breath, and that is not a good idea. Okay. And the other is that to use your abdominals. A lot of people end up using their abdominals instead of using their pelvic floor. Okay, so I'm going to change the visualization a little bit and how you do it. I'm going to ask you, don't do anything yet. I'm going to ask you to take a breath in, and then you're going to actually take a breath in as you pick up the marble. No, you know what? I'm sorry, I'm getting this wrong. My apologies. I told you I'm not very good at this. Okay, you're going to take a breath in. You're going to pick up the marble, and as you pick it up, you're going to breathe out through your mouth, sort of with pursed lips. So it's going to be a little bit like this. You take a breath in. You're going to grab the marble, and as you bring it up into the pelvis. Okay, I hope I haven't confused you too much, so my apologies if I have. Take just a normal breath in. Grab the marble and blow out as you bring the marble up into the pelvis. Okay, I'm going to give you a chance to do that a couple more times. Take a breath in, grab the marble, blow out. Okay, all right, that's something to practice. It may be that you're totally confused by the process, and I apologize if you are. It can be difficult. I just wanted to give you a little bit of sense of it. A couple things to remember is that, you know, if you're using that marble visualization, the marble is very light, so you don't have to put much effort into it. I think the tendency is to, especially if we're trying to find our pelvic floor muscles, just to overdo it. So you want to do it in a gentle manner. You just imagine it, you know, marbles don't weigh very much, but imagine it's lighter even than it is, as light as an ant. As I said, what you want to feel is muscles in the vaginal and the anal regions working, but you don't want to feel your buttocks pinching. That would be another thing that sometimes people do when they're not sure exactly where their pelvic floor muscles are. Some researchers have found that focusing on the anus is more beneficial in strengthening than focusing on the vagina. But I think you want to focus on what area that you feel the most. Okay, some people will tell me I feel it more in the vaginal region. Some people say I feel it more in the anal region. That certainly is very possible. And if you're really struggling with this, that's when you want to try to get some help. And this is where physical therapy can be a help. One more thing I want to say is that you can practice doing Kegels in different positions. I think for most people, lying on your side is an easier position to do it. You can try it on your back. I think on the side is easier. You have a better sense if you're overusing your tummy or not. Some people find it easier to do it in sitting. Some people even put a sort of a small folded towel in the perineal area, sort of like you're sitting on it. And that sometimes gives feedback that can help people feel what's happening a little bit more. So those are just possibilities of what to try. But don't feel bad. I want to introduce Emma Elton, who I think might be on this webinar. Emma's a therapist who is specializing in women's health. And so either of us certainly can help you with, if you're having incontinence problems that you feel like you need some professional help with. So please feel free to reach out to us if that is a help to you. What I want to finish with before I can take questions are just 13 tips to help keep your bladder healthy. And this is directly from the National Institute on Aging. They suggest that you drink enough fluids, especially water, and half your fluids should be water. Limit alcohol and caffeine, quit smoking, avoid constipation, keep a healthy weight, exercise regularly, do pelvic floor strengthening, use the bathroom. They suggest every 3 to 4 hours. Realize that sometimes if we've had a lot to drink, maybe a cup of coffee, we may not be able to go 3 or 4 hours. So the idea is don't be going to the bathroom every hour for sure, or too frequently. Sometimes there's certain times of the day, if we've had a diuretic, we might need to go to the bathroom more frequently, but it should even out as the day goes on. Take enough time to empty your bladder. Sometimes we just don't relax enough. We should be sitting on the toilet, ideally not hovering unless we're out in public. So sit in a relaxed position. They suggest that you want to wipe from front to back after using the toilet. They're saying this because we want to avoid any contamination of bacteria near the urethra. They suggest urination after sex, again, trying to keep bacterial levels down, and to wear cotton underwear and loose fitting clothes. Oops, sorry about that typo there. Okay. All right. So I am going to go to the chat box and see what questions we might have. Okay, is it true that cranberry juice is helpful for the bladder? To be honest with you, I don't feel like I have the knowledge to answer that question, so I don't know the answer to that. I've certainly heard that, but I can't give an official opinion, so. Okay, the next question is there a connection between generalized anxiety and bladder frequency? I would say that certainly could be true. I would think that there probably is a connection there. I'm sorry?
Oh, no, go ahead.
Okay. Okay, yeah. Well, okay, so there is more information here. The person's saying many women who experience general anxiety have upregulation of their pelvic floor. Okay. This overactivity, yeah. So this is sort of the opposite problem sometimes, even though these individuals can still experience incontinence, but anxiety could result in someone holding their pelvic floor muscles. So if we're holding our pelvic floor muscles all of the time, then it actually can make them seem weak. We think, oh no, wouldn't that make them strong? But no, the same thing. Let's say I had you hold a bowling ball for an hour. And then I said, okay, now I need you to do something with your hand, manipulate some screws or something. Well, you probably would have difficulty because your hand would be, the hand muscles would be so fatigued. So people who hold their pelvic floor muscles then can experience incontinence. They also can have difficulty relaxing their pelvic floor muscles enough to urinate. So it's sort of a different problem, and those people definitely need some help learning to relax their pelvic floor muscles. So it's sort of different than the typical stress incontinence problem. Okay, is there any other questions there?
Yeah, so
Okay.
Cheryl, to clarify.
Okay, to clarify, we exhale when picking up the marble. Yes, if possible. And I apologize, that probably was a little bit crazy to try to do over the internet, but yes, you would try to exhale at that point. Through pursed lips, ideally, that does help a little bit, sort of gently forcing the air out. How many repetitions and sets of exercise for the Kegels? And that's a good question. A lot of that depends on how strong your pelvic floor muscles are and how much endurance you have in them. So starting off, believe it or not, your pelvic floor muscles actually can get tired. And you're going to know that is when you're trying to do the contraction and you just feel like you're not doing it so well anymore. Your muscles are probably fatiguing. So if that happens fairly quickly, what you'd want to do is maybe hold the contraction. Well, okay, and you might ask, how long do you hold the contraction? For some people, they might have a hard time holding it more than 2 seconds. Other people might be able to hold it 5 seconds. Some people could hold it forever. But you want to, when you feel your muscle, let's say you hold it and you feel like you can get to 5 and you still have it pretty strong, that's a good place to start. If you get to 2 and it starts to peter out, you want to hold it for maybe then just 2 seconds. How many repetitions? I'd say if you could only hold it 2 seconds, you'd probably want to rest at least 4 seconds in between contractions and maybe do 10. You're going to have to see if you tire out before that. If you can hold it 10 seconds or longer, you can do 10, 15 or more of those in a row, then you've got pretty good endurance and you've got pretty good strength. So you can do more repetitions. If you're actually having stress incontinence problems, sometimes I like to tell people to maybe work on trying to do 50 in a day, 50 repetitions. You certainly wouldn't do them all at once. That can feel a little overwhelming, but if you did 5 at a time, of course you'd have to do that 10 times. So maybe 10 at a time, that would be 5 times in a day. I wouldn't worry about doing that many of them, but starting and doing some is a good thing. Now, for those of you who go to the gym regularly or do exercises at home, if you're able to contract your pelvic floor muscles while, let's say you're doing a rowing machine, the seated row at the gym, you might do something like contract your pelvic floor muscles, then do the row movement, the actual row, and then pull it towards you, let it go back, and then relax your pelvic floor. So you could get your contractions in while you're exercising at the gym. You don't want to be holding your pelvic floor muscles all of the time. By any means, that's not a normal thing. But sometimes, like when I take a walk, it's harder to contract the pelvic floor muscles at the same time when walking, but I will contract for a minute, a few seconds, and then relax just intermittently, not for the whole walk by any means, maybe just here and there for half a minute. Trying to get some of those pelvic floor contractions in Or let's say you have a little bit of urine leakage when you stand up from sitting down or when you get out of the bed or something. You can try to contract your pelvic floor muscles as you move, just through that movement, and that may be a way to help keep from leaking as much or leaking at all. But some of these, trying to contract your pelvic floor with movement can be a higher level activity and can be more difficult. So if you find that's difficult, then again, that's where sometimes it helps to get just a little bit of guidance from a therapist. Yeah, what would PT for incontinence involve? That can be very variable depending on what the person needs. So it could include anything from the use of biofeedback to learning about how to do pelvic floor strengthening, getting a lot of assistance from the therapist to help help you know if you're doing them correctly. With urge incontinence, it may be putting you on a time voiding pattern or program, excuse me. It may be giving you strategies of how to handle those strong urges. It's as variable as the problem that people come in with. So I hope that answers that. The next question, I've heard that squats can weaken the pelvic floor. I don't see that would necessarily be true unless you're holding your breath when you're squatting. And like if we think about like weightlifters who are lifting a lot of weight, I don't know very little about weightlifting, but if they were holding their breath while they're doing that, which I would hope they wouldn't be doing, then sure, that could weaken the pelvic floor. But performing a squat, I like when I often will progress my patients where they will be contracting their pelvic floor while doing a squat. So hope that answers that. How does one completely empty the bladder? So that urine does not dribble out minutes later. Usually if urine is dribbling out minutes later, there are other issues involved. That is not a normal thing, and it is not happening because your bladder is not empty. I mean, it's true that remember that our bladders do not fully empty, and we don't really want to try to sit on the toilet long enough, where we feel like we're really getting it all out. I think that's when you might want to start with your doctor, but also there's something else going on that's causing that dribbling to happen. So that's where I would start, would be with your primary care doctor. They might then want to send you to physical therapy, but it is not impossible to avoid that if that's a problem you're having, other than by dealing with the cause for it. All right, the next question. I always think that the latchkey incontinence is a conditioned response like Pavlov's dogs. Is there any training to condition a better response? Yeah, that's a good question. So, yeah, I mean, I don't know exactly why it happens. I think there is some truth to that. I think, again, I think it means that there's some bladder irritability anyway. For some people, like if they hear running water, that can make them feel like they need to urinate. I think that one's a little bit more common. But what I would say is, if you find you have that problem, maybe before you put the key in the door, if you feel like you are able to contract your pelvic floor muscles, you feel pretty confident of your ability to do so, I would stand there and I would just tighten my pelvic floor. I would hold it for 5 seconds. I would relax my pelvic floor and I'd put the key in the door. See what happens. If you get hit with an urge, then I would do it again. I would stop. I would just tighten my pelvic floor, wait for that urge to pass, and then continue on through the door. If you get halfway to the bathroom and it hits again, I would stop, tighten your pelvic floor, wait for the urge to pass, and then go on to the bathroom. I think that's the best thing you can do. All right, your marble directions were fine. Oh, thank you. I have to, I really, when a patient told me about that, I was like, oh, I'm going to remember this one. Okay. Sometimes I find that after I finish urinating, I have to sit there for 30 to 45 seconds and then start urinating again. Well, my question is, do you have to, or do you find that if you sit there for another 30 to 45 seconds that you will urinate again? And the answer to that one is yes. I'm not surprised on the second one. Remember that the bladder doesn't empty fully. So if I'm working on a crossword puzzle and I've already urinated once and I'm just sitting and finishing my puzzle, will I probably urinate again? Yeah. But we shouldn't necessarily sit there and wait for that to happen. Okay, it's normal for some urine to remain in the bladder, so it's okay. Once we've urinated, we can get up. Okay. My doctor told me that women can empty bladder more completely by tipping the pelvis forward after urinating, leaning away from the toilet tank. Okay, I'm able to void a little more this way. If you're having trouble emptying your bladder, and there can be reasons for this to be true, this is exactly right. So we can urinate both sitting upright or slumping, but typically our body naturally usually goes to a more upright position for urination and a more flexed position or a more relaxed position of slumping for defecation. Okay, that's sort of the natural tendency of the body. So yes, if you sit tall or lean forward, that will help empty the bladder. I don't know that it's necessary, but it's certainly, if you're having trouble with greater than normal post-void residual, then that sounds like a good idea to do. Why does bending over help control the urge to urinate? I don't really have an answer for that. I've not heard too many people say that, but it makes sense that maybe it could be true. If it helps, go for it. A lot of people, the most natural tendency is for people to sort of squeeze their knees together if they're, and try to, of course, tighten the pelvic floor. Okay, I think that might be the last question. So I might turn it back over to Angela. I just want to say thank you for listening. I hope it was of some help to you. Again, if you're having issues, probably the first person to talk to is your primary care doctor, but realize that physical therapy can be a help with incontinence problems. Okay, so I don't know if Angela has anything more to say, but anyway, wish you well. Take care.